Thyroid gland is a gland which is located in the front of the neck. It secretes thyroid hormones which regulate metabolism. Now, metabolism is how we use our energy. Sometimes if the thyroid gland is overactive, then the metabolism speeds up and it causes symptoms. If it is on the lower side and underactive, then the metabolism can slow down and that can cause symptoms. Apart from an overactive and an underactive gland, we also look at the structure of the gland. Has it got any nodules? Are they benign nodules? Are they suspicious? Borderline or frankly cancerous looking nodules. So just like any gland, we look at the function and then also the structure of the gland. Thyroid gland is very important for our day-to-day life. Any dysfunction, either overactive or underactive, can make us feel tired. It can affect our metabolism, the way we go about in our day. An overactive gland can cause weight loss, an underactive gland can cause weight gain. Again, various other symptoms of heart rate. An overactive gland can cause faster heart rate and palpitations. An underactive gland can cause a lower heart rate, hair growth abnormalities, nails, just feeling unwell, period disturbances, bowel disturbances. All of these are related to the metabolism and that can be affected. In regards to the structure of the glands, any lumps in the thyroid gland can be nodules. These nodules mostly are benign, but there can be some cancerous nodules which are important to recognize, investigate, and remove them. So these are the main kind of abnormalities of the thyroid gland. In addition to this, there are some minor abnormalities which can happen when we are ill. It's also called non-thyroidal illness or thyroiditis, which can recover. Any illness, fevers, bacterial illness, or sometimes pregnancy can also affect the thyroid glands. And these need to be investigated to make sure that the thyroid is functioning properly. As we were talking about thyroid disorders, any dysfunction of the gland can be either overactive or underactive. There can be borderline overactivity and borderline underactivity, which we call technically as subclinical states. All of these spectrum from underactivity to overactivity can cause a variety of symptoms which can be at either end. So an overactive thyroid gland, it can cause weight loss, it can cause severe tiredness, palpitations, heat intolerance and sweating, frequency to go to the toilet, to open bowels, menstrual problems. These can happen. Now, a severely overactive thyroid gland can cause certain medical emergencies called a thyroid storm, which may need urgent clinical attention and treatment and to control the symptoms. If we don't treat an overactive thyroid gland in the long run, it can affect the heart and it can affect the bones like osteoporosis. It can cause strokes, heart rhythm abnormalities like atrial fibrillation. So it is important that we recognize this right in the beginning, check how this overactive thyroid gland has come about, like is it Graves' thyroid problem, or is it a thyroid nodule which is overfunctioning, because both of them have different modalities of treatment in the long run, and also recognize any kind of effects it's having on other parts of the body, like Graves' disease can affect the eyes as well. It's called thyroid eye disease. Sometimes it can affect various other autoimmune, go along with various other autoimmune conditions, which is important to check and address. So that's an overactive thyroid gland. An underactive thyroid is on the opposite side of the spectrum, where there's weight gain, tiredness, fatigue, brain fog, cloudiness of memory, hair loss, poor nails, constipation. All of these can be a symptom of an underactive thyroid gland. Usually it is autoimmune in origin, and it's very common. It's important to look at an underactive thyroid gland and also a borderline underactive thyroid gland to correct these abnormalities so that we can have a good, healthy outlook to life and prevent future complications. When we come to thyroid nodules, again, they're very common. They can happen even without an overfunctioning or an underfunctioning gland. And if they do happen without any overfunction or underfunction, we scan them to check that they look benign. If required, sometimes we do biopsies. We call them fine needle aspirations to ensure that they are not harboring any cancerous cells. And sometimes, frankly, cancerous thyroid glands, particularly when they have a family history, it's very important to recognize this and remove them by thyroid surgery, so that it doesn't cause any complications in the future. Minor abnormalities like thyroiditis after a viral illness usually recovers, but sometimes it may not recover and can cause long-term underactive thyroids under certain occasions. And this needs to be recognized and treated so that we have a good, healthy outlook to life and prevent complications. Thyroid disorders are very common. Sometimes they can go unrecognized if patients do not have symptoms. And some patients are extremely sensitive to even minor abnormalities in the thyroid function, and they can be diagnosed. An undiagnosed thyroid problem in a long run, be it overactive or underactive, can have certain clinical complications which need to be avoided. So it's important to check it. And once you check it, can it be managed at home is a question that has to be supervised by a doctor. It is important to recognize what you can manage at home and what you need help with your doctor or GP. Certain types of borderline underactive thyroid can be managed at home with the GP. Other disorders like overactive thyroids and severely underactive thyroid and any kind of in between where it is a complex thyroid nodules and stuff, they need specialist advice. Of course, healthy lifestyle is important. Good diet, plenty of plants and vegetables to keep our gut microorganisms healthy. We'll try to prevent any future problems happening. However, autoimmune conditions sometimes can trigger at any time, and these need to be evaluated. The same with thyroid nodules, they need to be evaluated to check if they are benign looking nodules or cancerous looking nodules. So managing at home it has to be done under guidance. And number two, most of the underactive thyroid glands can be managed at home under supervision of a GP. But anything above this, which is still remaining symptomatic, or an overactive thyroid gland, or a suspicious looking thyroid nodules, they need specialist care. A prompt diagnosis is important, not just for quality of life, but to prevent future complications. So let's divide this into three categories. Number one is an overactive thyroid gland. It can be due to an immune problem called Graves' thyroid problem, which can sometimes affect the eyes as well, called thyroid eye disease. An overactive thyroid can be due to an overfunctioning thyroid nodule. So one nodule starts overfunctioning. And sometimes we can see on a third aspect, a transient inflammation in the thyroid can cause the symptoms. And it's important for us to see what is what, because a Graves' overactive thyroid can be treated by tablets and sometimes will require higher medication modalities like radioiodine or sometimes thyroid surgery. A specialist doctor will decide based on the age of the patients, based on pre-existing conditions, what is the right modality of treatment. Thyroid overfunctioning nodules will sometimes may not remain quiet in the long run and will need stronger treatments like radioiodine or thyroid surgery. This will be looked at by a specialist doctor and with the help of past history of any complications, decide with the patients, that is you, to say what is the right mode suited for you in regards to the options. The second one, the most common one, is an underactive thyroid. And an underactive thyroid, again, has to be treated. It all depends upon how underactive the thyroid gland is, what are the immune-related issues, how old the person is, and whether this needs treatment in respect to variety of these conditions coexisting together. And this, again, will be done by a specialist or a GP because it's a very common condition. And despite sometimes having good treatment with thyroxine, patients do remain symptomatic. They tend to have tiredness and feel unwell. And we have to look at associated clinical problems like the adrenal gland problems or diabetes and stuff like that. So it is important to get this evaluated and checked. And finally, the third most common problem is a thyroid nodule. Most of them are benign nodules, but it's important to characterize them. Once we characterize this as benign, we can be confident that this doesn't need any treatment. And if it is indeterminate, we may need to do a small biopsy called needle aspiration cytology. Or if it is cancerous looking, we may need to remove them, and the treatment would be surgical under such circumstances. Some nodules may be quite large and quite unsightly, so a cosmetic approach may also need to be incorporated when we see this. So it is a tailored approach to the gland, to the activity of the gland, and patient preferences. All of this has to be done with the help of a specialist doctor, with the help of a GP who can recommend you to a specialist doctor, and also with good lifestyle measures like avoiding smoking, which can aggravate an overactive thyroid gland, good diet, and proper kind of sleep, and all the lifestyle measures which are important for our day-to-day life.